Hello, everyone. It's a pleasure to be with you virtually to discuss hearing conservation considerations in the modern workforce. My name is Heather Malyuk. I'm a doctor of audiology located in Northeast Ohio, and I'm excited to talk about this with you today. I'm going to show you some data, and we're going to talk about care of the modern workforce, and I believe that these are individuals who need audiologists. Okay, so it's a very exciting topic to me. In terms of a little bit of background on myself, if you know me, you probably know that I'm a hyper specialist in music audiology, and I have been a music audiologist for over a decade. What you might not know is that for quite a few years now, probably since 2016, I've been working in teleaudiology. And for the past about 3 years or so, I've really become sort of a hyper specialist in that realm as well. I am a business owner. I own a private practice called Soundcheck Audiology in Cuyahoga Falls, Ohio. And I have also found myself for the past 10 years involved with a lot of organizations and on a lot of research teams. And I find that work very exciting because I think it moves our field forward. And I really hope that if there's a researcher listening today, that you get inspired by this topic and that you continue research in this area. And I wear a lot of other hats in the field of audiology as well. Now, I do want to disclose that I am head of audiology for a teleaudiology company called Tuned. And I am going to show data today as sort of the meat and potatoes of the presentation that was collected through my role at Tuned. However, I want to make it very clear that this presentation isn't about Tuned. It was not sponsored by Tuned. And a lot of what I'm discussing today can be completed in clinics on other platforms. It just so happens that Tuned has a lot of patients from the modern workforce because of how the company is run as a benefit for individuals. Okay, so audiology as a benefit. So just wanted to make that clear before moving on. Our agenda today, introduction, already done. We're going to do some literature review and discuss hearing conservation a little bit in terms of the traditional sense. So a few slides on that. I'm going to show you that recent data that I mentioned. So very interesting survey that was conducted in the modern working population. And then I want to discuss care of these individuals via telehealth, and what we can really do for them. I'm going to give you just some little vignettes, snippets of some case studies, some individuals I've seen, and what I have run into in this population. What I would like for you to be able to do at the end of this half hour is describe how this population is using headphones, earphones, headsets, so ear level devices, and what our role is as audiologists. If you are an audiologist listening to this, I would like for you to end this session with, I have some really concrete ideas of what I would do with a patient who walked into my clinic or saw me via teleaudiology. Listing potential risks associated with ear level devices and their use. And then identifying a couple of points of education for individuals who wear ear level devices for work. Most of my appointments, if you have ever worked with me, I'm really big on education. I sometimes overeducate individuals, but I really believe that this is the heart of the matter. Hearing loss prevention, a huge portion of it is education. Okay, so when I was getting ready for this, these are questions that popped into my head that I wanted to try and answer for you, because I think these are questions that a typical audiologist or someone working in the hearing healthcare field might ask. What is our role? Do they need us? Does the modern workforce need hearing care? What do we even know about this population? How do we effectively reach this population if they're not walking into our clinics? How do we effectively care for them? What are some new ways of caring for them? So I hope that these will be answered by the end of today. In terms of a literature review, I have about 4 slides on this, and I want to preface the literature review by saying individuals who I am discussing, the modern workforce, people in their 20s to 50s who are wearing these, who are white collar workers wearing ear level devices, there's not a lot of research on them. Okay, so I just want to give you an overview of some papers I found interesting. I really found about 20 or 30 that could apply in some way, but I'm just showing you a smattering here. And I do think that this is an area where we need to take a deeper dive. So, of course, I had to bring up the World Health Organization statistics, and they say that globally 430 million people have hearing loss affecting their quality of life. By 2050, we can potentially expect that number to increase to 700 million. However, over half could be preventable. That's really good news. I do think our role in that is huge. And in terms of the USA, I'm not sure if you were aware, over half of the counties in the United States don't have an audiologist. I think the exact number is 56.6%. This is very interesting. When you work in the hearing healthcare field, and when you work in audiology, you feel like you see it everywhere, and that your whole life is audiology. But when you think about the general population, we're not around for them. We're a very small field. So how can we be more effective in reaching more people? To me, over half of the counties not having an audiologist is sad. How can we grow? How can we grow into that area? There was an interesting study done last year in 2022 comparing normal hearing participants with white-collar workers with hearing loss. And they found that white-collar workers with hearing loss had increased odds of non-optimal work performance. Additionally, this paper reported that women confirmed not doing jobs properly due to hearing loss more so than men. Okay, so just an interesting tidbit there. In 2016, there was a study done looking over at over 500,000 individuals, ages 55 to 64. They had to have a classification code of hearing loss. And what they did was they tracked the healthcare billing of these individuals for 18 months. So they found a couple interesting points. If you have time to actually look at this paper, I highly recommend it. I thought it was fascinating. But two main points here that I found most interesting was that individuals with hearing loss who received hearing services had lower overall mean costs in terms of healthcare billing than patients with hearing loss who did not receive hearing services. Additionally, payments were significantly lower for patients without hearing loss than with. Rick Neitzel and colleagues back in 2017 published a paper, and it estimated that hearing loss affects more than 13% of the working population. Of the causes of hearing loss, if the 20% of hearing loss cases from noise exposure were prevented, the economic benefit would have a core estimate of 123 billion. They did state that this estimate is conservative. So, this says noise exposure. There are a lot of papers looking at noise exposure. I tend to say sound exposure because individuals using headsets for work, maybe they're on meetings for a number of hours a day, it's not really considered noise. However, it still can be a damaging or injuring stimulus. So let's look at traditional hearing conservation for just a moment. If you work as a hearing conservation audiologist, you can zone out for maybe 2 minutes. But I do think this applies, and here's why. I believe that anytime we look at a new area of care or a new way of caring for people, we need to go back to the roots first. And traditional hearing conservation is the family tree that we are budding from in terms of this conversation. So traditional hearing conservation is thought to be only for those who are regulated by the Occupational Safety and Health Administration. It is a legal liability kind of thing, and also a protective thing, protecting workers. I do think that hearing conservation, however, is for everyone, but it will stem from this regulated aspect. If someone is under a hearing conservation program or enrolled in one because they are noise exposed to the point of needing a hearing conservation program, that workplace must follow the OSHA Code of Federal Regulation 1910.95. So many audiologists are familiar with the OSHA scale, the safety scale, and it does differ from the National Institute of Occupational Safety and Health scale, the NIOSH scale. I have both listed here. For an 8-hour workday, OSHA starts at 90 dB and has a 5 dB exchange rate. So when you go up to 95 dB, you cut your safety time in half, etc. NIOSH starts at 85 dB for an 8-hour period. Every 3 dB you add, the safety time gets cut in half. And I just realized I'm only saying dB, and that doesn't mean much. It is A-weighted dBA SPL. So why do I have these here? And, why am I showing you this? Every time I meet with a patient and they ask me about protecting their hearing, I teach them these scales, and I teach them the concept of not just intensity or what they perceive as volume of sound, but their length of exposure. I find that in the appointments with individuals who are wanting to learn about protecting themselves, this is an eye-opener for them, especially when they're using ear-level devices and they say, well, I didn't realize that I would be at risk based on my length of exposure. Or they might say, well, I'm not a factory worker, but why are my ears feeling tired? What am I dealing with here? And you say, well, gosh, you're using these 8 hours a day at 100% volume. You might be hurting yourself. And so I think it's really important for individuals to learn both of these. Reason being is NIOSH will be more protective. I like for them to know what OSHA states, but we know that OSHA will protect about 3/4 of the population, where NIOSH is more like 92% of the population. So if someone can follow the NIOSH scale, I think it's a good thing. Looking at the goals of traditional hearing conservation, of course, the goal is to prevent noise-induced hearing loss. Those of us who work in the field, though, it's much more than that. We're trying to lessen the incidence of tinnitus, hyperacusis, and other disorders, or maybe prevent them from worsening. And we also think of things like cochlear synaptopathy. And I put maybe on here because, of course, we know it's still being researched. Maybe one day we'll find that exact diagnostic marker and exactly how we can prevent it. But I think it's worth mentioning and keeping in mind. When someone is following a traditional hearing conservation program, there are 7 parts to the program in that Code of Federal Regulations. So monitoring noise exposures, looking at engineering controls and work practices, making sure the employee has hearing protectors with an adequate noise reduction, training and education, of course, that's huge, baseline and annual audiometry, procedures for preventing further hearing loss if an occupational loss is identified, and then, of course, record keeping. And don't zone out here. There's a reason I'm going through all these parts. You really can do each part of this with an individual patient. For the past, 6, 7 years, I've been doing orchestra programs where we follow much of this. What can you do most easily, though? If you have someone walk into your office or meet with you via telehealth, there are pieces here that are low-hanging fruit. And even though I think you can do everything, these might be the points that you can hit most easily. So looking at work practices, training and education, baseline and annual audiometry, or screening, basic screenings, even a questionnaire screening, depending on who it is and what you're doing, just looking for red flags, that kind of thing. Procedures for preventing further occupational hearing loss, and then record keeping. Okay, so the modern patient population, who is it? I think these pictures kind of represent individuals that I am seeing from this population, people who are working, they're on calls many hours a day. Since the pandemic, they're working remotely or in a hybrid fashion, and they're fairly young. What can we do with them? So this is the study I mentioned that came from Tuned, part of my role with Tuned. We really wanted to try and get to know these folks and dove into the literature, and there really wasn't a lot of information. So we put a survey together, and we were trying to determine a couple of things: their access to hearing health via their employer, and then also personal hearing practices. In terms of respondents, we had 355 individuals from a variety of job types, which you can see here on this pie chart. Engineers, we had people from finance, HR, IT, sales, management, operations, support, data, other. I think this was pretty representative of a white-collar workforce. We also had a wide range of demographics. We focused on the United States, but every part of the United States was represented. We had people from all over the country. About 30% identified as non-white. We had ages 20 to 65 years old represented. And we had a wide range of socioeconomic status. You can see salary ranges here. So everywhere from between $15,000 to $30,000 annually to over $150,000. It's a pretty good spread there. They were asked about the effect of a hearing issue on their work. So if they were dealing with a hearing issue, how is it affecting what they were doing? About 47%, no issue, not affecting anything. Okay. But otherwise, we've got 10% leaving work early, 9% calling in sick, 14% taking an extra break, 8% failing to complete a task, and then 12% completing a task incorrectly. Okay, so there is some effect going on here. In this population of 355 individuals, 67% could define audiologist. So I thought that was pretty high, actually. However, it still left 33% who really had no clue. And this was an open-ended response, and you should have seen some of the responses. Just no clue what an audiologist was. Some of them were kind of funny, people trying to guess at what it might be. Over half had not seen an audiologist. Okay, so I think we probably could have guessed that, honestly. Over half not seen an audiologist. We wish more people came to see us, right? So again, the whole point of this, how do we reach these individuals? So what I did with this data, I wanted to look at a more homogeneous set. So looking at them, I took 80% who were employed full-time. So let's look at just full-time workers. They were all remote or hybrid. 83% receive health benefits from their employer, with 46% of those receiving hearing benefits. And hearing benefits is mostly discounted hearing aids. So not exactly what we would think of as audiologists in terms of really full care, of these people. But when I looked at all of these factors, I ended up with 233. So the next few charts and graphs we're going to look at focused on these individuals, 233 individuals. They were asked about the estimated hours of ear level device use per day. And to me, this is a lot. So about half are using something on their ears at least 5 hours a day. 12% are using them 9 or more hours a day. Okay, so in terms of that, listening to something, it could be meetings, it could be music, it could be podcasts. So we weren't specific about that, but headset use per day. They were asked about the presence of listening fatigue at the end of their workday. And these individuals, 60% notice auditory or listening fatigue at the end of the day. That's a very large number. Okay, very large number. I think this should be eye-opening for us. And again, I do think this would be considered just sort of a basic starter study that all of you should go and do more work in this. And I'm hoping to do more work in this as well. But this is just a glimpse into this population. With this data set, 52% admitted additional breaks throughout the day because of listening fatigue. Over half. 49% reported more than 5 hours of ear level device use for work. So think about the time they spend working out, other recreational activities. It's not just those 5 hours, it's probably more. 43% disclosed having tinnitus, and 26% disclosed that their tinnitus increased, and they had an increase in perceived hearing issues since the pandemic, so since working remotely. That was very interesting as well. Where's the care on that side of things? So when I think about potential risks for this population, maybe temporary threshold shift, is the listening fatigue we're dealing with, is it TTS? Is it something else? Is it linked to Zoom fatigue? I think these are all potential areas for research. What are we really looking at here? Of course, a risk of permanent threshold shift or hearing loss. Maybe cochlear synaptopathy, hidden hearing loss, maybe. Again, put the question mark there because I think there's still a lot to learn in that realm. Tinnitus, we know. Look at what was just on the last slide, an increase in their perception of tinnitus. Other auditory disorders, potentially. And then also risks here, I think, in terms of prevention, perhaps a lack of early identification of auditory and vestibular issues. Could we be reaching people at a younger age with audiologic care and identifying things earlier? That would be wonderful. So let's discuss care via telehealth, because I think that really is the easiest way to reach this population. Teleaudiology is becoming a benefit for many companies. It certainly is through Tuned. That is primarily what Tuned does, but there are other teleaudiology companies doing this as well. I think hearing conservation, based on what I have seen with patients, is a huge part of this. Okay, so many people I'm seeing, which I'm going to do little, again, vignettes of patients in a moment, a lot of them want to know about protecting their hearing or preventing tinnitus from getting worse. Hearing screenings are a role of this, but you need to be very careful when discussing hearing screenings versus diagnostics. And I'm going to talk about limitations of telehealth in a minute, and I'm going to discuss this more in detail. Tinnitus therapy, triage, looking for red flags. Perhaps someone has a benefit. They get on a call with an audiologist and a major red flag is identified and they figure out who to go to. Okay. I have run into that several times, and it has been very helpful for individuals to speak with an audiologist first and get guidance. So that's my last point here. Education and guidance is a very, very large part of what these individuals need. So let me just talk through a couple of case studies, a few case studies. These are patients that I have seen via telehealth. Now, my average patient age is probably like early 30s, if I think of the average. And just 3 examples. First is a woman, mid-30s, dealing with auditory fatigue, listening fatigue, working in transcription, and she was just a fascinating case study. If you've heard me speak about this before, I've used her as a case study before. But working 10-hour days using headphones, and at the end of her work day, she did not want to speak to anyone. She did not want to speak to her boyfriend. She did not want to do anything because she was done listening. And in her words, her ears were just tired. She would work 4 tens was her work week. She met with me, sought me out because she had a benefit, and she wanted to know how she could protect herself. She was using her headphones at 100% volume because she was having a hard time hearing clearly on the different types of recordings she was getting. And so she and I ended up doing a new type of headphone and spoke with her IT. She spoke with her IT department, got her Windows updated, and started using Sonic Cloud software. Now, mind you, she did not have any other auditory complaints. She did several hearing screenings. There were really no red flags, even on a really lengthy questionnaire. And when I spoke with her, she said, really, nothing's wrong. It's just at the end of the day, I'm so exhausted. And so with the Sonic Cloud software, we were able to EQ her listening. I walked her through, speech clarity presets they have using, individual EQing herself, and it changed her life. It really changed her life. She was able to keep her volume down. She was much happier. She felt like she had some control. It was great. And that's what she needed. The next example I have here is a man in his mid-20s who he thought he might have auditory processing disorder. He had read about it. And he got on a call with me, again, because he had a benefit. And he started talking to me about his experience throughout his life, how exhausted he always is. He feels like he can't hear anything clearly, and how it's gotten a lot worse since working remotely. So I discussed auditory processing disorder with him, did a couple of screeners with him, and I said to him, I think you might be dealing with this. Can I refer you to a specialist in this area? And he was so excited to have information, and he was so excited to do some screeners and finally be on the right path. And that might seem really simple, but it really changed his life. I saw him last year, and I did check in with him, sent him an email, said, how you doing? And he's doing really well. So he was, I think, disappointed that this hadn't been caught at a younger age. But he suddenly had a benefit through work, got an appointment, very exciting for him. And then finally, a woman in her mid-30s with tinnitus. This was surprising to me. She had seen an audiologist, had a lot of diagnostics done. She uploaded them to her patient portal. Her hearing was great, no issues, not sure how the tinnitus started. And she had been told at the clinic, there's not much you can do. Your hearing's normal. Good luck, kind of thing. And I think I think the audiologist really did the best that she could do. There's nothing to be said against any audiologist. It just, they maybe didn't have the right tools for her there. So she met with me, and I talked about tinnitus with her and her audiologic results. And she was able to go on and do therapy. Again, wonderful triage approach, get them on the right path. And of course, I have so many examples like this, so many examples. But these are just a few little vignettes of how telehealth is reaching individuals who might not otherwise go into a clinic. Now, the first 2 patients I saw didn't want to go into a clinic because they think that audiologists just fit hearing aids on elderly people. That was the perception from the first 2. The third, she went to see an audiologist, and she wasn't able to get on the right path of care. So my question is, where's our field? How are we filling this in? I think telehealth, again, is low-hanging fruit for these individuals. There are some limitations, though. And I think I always like to point these out. I am an advocate of telehealth, but it does have its limitations. And there is very much a role for in-person care as well. So the first thing immediately that pops into the minds of audiologists, screening versus diagnostic testing. A few slides ago, I had the words, be careful. When you're discussing this with patients, every time I discuss this with patients, I'm very clear that it is not the same as going to see an audiologist in person. There are transducer issues. So unless you're sending a kit out to the patient that has been calibrated in some way, maybe there's a tech on the other end, that's a different type of telehealth than what I'm discussing. In the past number of years, we have seen screeners pop up on websites, clinic websites, hearing aid websites from a number of creators, okay? So the validation of these is typically done with a certain type of transducer and a certain type of device. Some of these companies don't do any validation measures. When I was looking for screeners for Tuned, it was really shocking to me, meeting with a couple of the companies and saying, could I see information on your validation studies? Do you have any white papers? And there was nothing to show me. They hadn't really done anything. To me, that was appalling. Of course, we didn't use companies like that. But even with a company that's done fantastic validation measures, the end user is not always using the exact devices that were used in the study. And so you might get someone where the transducer, is very sensitive, maybe has a low impedance. You're going to get a different result than, you can't say that it's clinically validated within a certain range at that point. Okay, so my point here is you can really look for red flags and get an idea of the person. Many individuals, I do recommend that they go and get diagnostic testing. Okay, and again, it's just that they need the right path. They need to be taught where to go. There's also a lack of otoscopy sometimes. Now, there are kits that can be sent out. There are companies that create, tablet devices, where you can send it out to the patient, an at-home kit. They can take a picture via otoscopy. You can look at it. So there are workarounds there. But just the average person who gets on and speaks with you, no, maybe you can't do otoscopy. The last limitation here is in terms of our field. So I have noticed now, doing this a few years in terms of onboarding audiologists for telehealth and teaching them how to do this, some audiologists don't like it. So, that's a limitation. If you don't like to speak to someone and really educate and do screeners and talk things through, then that's a limitation. Don't do it at that point. Okay, so the role and the desire of an audiologist. One thing I love about audiology is how diverse our field is and how many specializations there are. I'm not saying everyone should go into telehealth. Some individuals love to do that back-to-back quick diagnostic testing. Some people really love, fitting hearing aids in person in the clinic. And some people love this type of non-regulated hearing conservation and guidance. So you just find what works for you. In summary, I believe that audiologic care is for everyone. And I really think that the modern workforce needs us. I think that they need us based on who I'm seeing and based on the survey study we did and based on what I hope will be new research coming out. I think that there is a public health component here. And I think we could prevent a lot of hearing loss and offer a lot of guidance toward proper care for these individuals. Teleaudiology, telehealth, from what I'm seeing, is reaching so many people who would otherwise not seek us out. Okay, the companies like Tuned, like others that are coming out, becoming a benefit, they are helping so many people, and it's through teleaudiology. So while it has many applications, teleaudiology, you can do a lot. Therapy for disorders, etc. Non-regulated hearing conservation, I really think is a gap that's ready to be filled this instant, okay, right now. And if you want to talk more about this with me, I do have several case studies of individuals I have seen in terms of that very specific non-regulated hearing conservation measures we took, recommendations I gave, and how they're doing. I would be happy to share that with you. So these are the references from my slides. And then this is my email address, heather@tunedcare.com. I will take your questions, your comments, your challenges, and I would love to have a discussion with you. Thank you so much for having me, and I hope to hear from all of you. Thank you so much.